I think my problem with universal healthcare,
Okay.
and I think this is a lot of people's problem, is what is the standard of care? Because even in foreign countries, like in South Korea, they have private health insurance. And I think that's a big myth that a lot of people in America believe. It's like they're just, it's a government, provided healthcare and they provide for everything. And, that's how their system works. But it's really not. They have private healthcare in Canada and Britain, and all these other countries.
No, I think Britain is entirely, they might have some sort of supplemental care, but Britain, it's entirely, the NHS is completely socialized, isn't it?
Yeah. I mean, the NHS is the biggest part of it.
Yeah.
Right.
But
That's
like the care is all
95% of the cake.
Anyway, I get what you're saying. Yeah, there's most other countries have supplemental insurance where you can purchase it on top of the care you're already getting.
So my issue is, what is the standard of care for Latin America?
I think
are you just saying everyone can go out and get what's up?
I think that the standard of care would go up, but you finish what you were saying.
No, but I'm saying so your universal health care, like you're giving what care to everybody? What is it? Like what are you giving to everybody?
Yeah, so let's define our terms, I guess. I support Medicare for all, basically what Bernie Sanders was running on. There's two different forms of Medicare for all. There's the one that Bernie Sanders put forward, and then there's Pramila Jayapal. She's a congresswoman out of Washington. She also put forward a plan. Both of them are essentially the same, just the funding that's different. But basically, it is the hospitals and everything would still be kind of private and everything. There would still be like private practices and everything. It would just be paid for with the government. So think of eliminating private health insurance, and it would just be government insurance. The government would be the insurance provider. Kind of cutting out the middleman.
Would you be for eliminating? You're saying you'd be for eliminating private healthcare in general?
Private insurance specifically, because there would still be private practices. You could be a private doctor. It's just that the pay would come from the government.
Okay. So, and I mean, like, then you would have to get into, because like one of the way the NHS work is they cap what surgeries cost, and like what certain medications cost, what certain, and they like what.
Well, considering how expensive healthcare is, that seems like a good thing, no?
Yeah, I mean, so I think, I mean, like I said, like healthcare for me, like I'm not overly versed in it. I do definitely think that healthcare in this country is super expensive, but as someone so I'm in the military, so it gives me a very unique view, because essentially the military is Medicare for all.
You're enjoying your government healthcare, huh? It's pretty nice, isn't it?
But it's funny. It's not. It's actually like really, really terrible.
Well, so what's the problem with it?
Like health in the military. So for instance, like if I needed, so I was on a waiting list for 2 years to get a procedure done. That
was it something that you needed like tomorrow though?
This is something the military deemed I needed.
Okay.
So like, I mean, yeah, I don't want to say I needed it or I was going to die.
Okay.
Right. But the United States Army said, hey, you need to get this done.
Yeah.
Right. And it took them 2 years for me to get that done.
Yeah.
And one of the ways, I guess, the military does it is the military takes definitely not the best doctors.
Okay.
Right. So like the doctors that come into the military, they're definitely they're not the A's and like the high GPAs of the medical community, and like a lot of them have like medical malpractice issues going against them when they come into the military, and they continue they continue to practice there. But I mean, being in the military, like I think like it's hard, to get braces. It's hard to go to the clinic and get whatever you need. It's not a perfect system by any means. And I think if you were to implement that on a large scale in this country, I mean, I think funding, like, I mean, obviously it's going to cost a lot of money.
Oh yeah, I think but it's cheaper than our current system.
Is it?
There was a study done out of Harvard. It put Medicare for all at, I think, $32 trillion for 10 years. Does that number sound like you heard that number before? Like 32 trillion?
I mean, that's what our current system is?
No. So Medicare for all would cost $32 trillion over 10 years. But that same study put our current, just the way that we do healthcare, at $35 trillion for 10 years. So if we switch to a Medicare for all system, it would save about $3 trillion over 10 years. And that makes sense because of like a few things you could think about. Medicare, it takes a lot less administrative costs because, economies of scale. As something gets bigger, there's less administrative work that's involved with it. You can, certain people can do more things. And then there's also bargaining for prices. Medicare gets some of the best prices when it comes to pharmaceutical drugs. And there's also, you take out the profit motive. When you have, I think the healthcare, the private insurance industry made like $200 billion in 2019. I mean, when you have a Medicare for all system, there is no profit motive. There is no those profits that like that little amount of money right there would just disappear basically, and it'd get passed on
Right.
to the American people.
So I think if you were to look at, I could say my biggest problems with the healthcare system now
Okay.
is the amount of money that doctors make per compared to nurses. Right. Like I think
Interesting.
nurses are like really, really underpaid compared to like what doctors are. But like doctor costs, that's what inflates, their overall cost of, because the hospital puts that cost onto the consumer.
Definitely. Like, are you referring to like malpractice insurance? Why that's so expensive?
I mean, like, yeah, like, but I'm saying like a doctor, like a normal doctor makes like $230,000 a year.
Yeah.
Right. But it does like what, like 10, like I don't want to say 10%, like 30% of what the nurse actually does.
Yeah. Okay.
Right. So
I'm
I
all
feel
for
like
paying nurses more.